A lot of people think that testing is going to really solve the whole problem, and it isn't. It's one component of a response. If you test somebody today, you only know if they're infected today. And in fact, if you're testing in a population that doesn't have very much COVID, you'll get false positives almost half the time. That is, the person actually doesn't have COVID, they have something else, they may have nothing. So it will just complicate the picture. On the other hand, if we have evidence of a case, even a suspect case in a school, all the contacts of that case, be it a child or a teacher, would be tested, regardless of whether they're symptomatic or not. That is something we've learned with COVID. It's very important to do that. That is when we might be identifying people who are asymptomatic and infected that need to stay home and wait till they're cleared by public health. Doing testing on all the teachers would be a huge amount of resources taken away from the need for quick access to testing when somebody may be symptomatic. We also need to do screening for symptoms, and everybody needs to be educated about the symptoms to look for and not go to work if you're sick, not go to school if you're sick. Those are the things that are important, along with hand washing, distancing, masking, all the things we're talking about. Testing will not actually achieve anything other than take resources away from other places they need to be. Yes, we've all certainly been able to develop our own social circle or bubble, up to a total of 10 people who we can interact with without protections. And that certainly continues. I think that's an important element of keeping us all healthy and knowing who we've been in contact with if in the circumstance that one of us does become ill. However, we can't keep that for schools because it just wouldn't be workable. And I think we are now looking at, we have flattened the curve. We have, at this point today, I think we had 89 new cases, which is good. We're under 100. Let's hope we stay there. We're doing our best. But as we open up society and go into stage 3, we need to look at the children's health. And it is not healthy for them to keep staying at home. They need to go to school. They need to go to school for their development, for their health, their physical, social, and mental well-being. And so we are doing it in the most healthful way we can, but it is beyond the social circle, obviously. But we are looking at cohorting. So in the circumstance where there is a case in a school, we will be able to get the information from the school in terms of who was that individual in contact with in the period they may have been infectious, which is usually up to 2 days before some symptom onset. And we will be able to contact those people and test them quickly. So it's not a social circle, but it is a cohort, and it's going to be very useful for us in the instance where we do have a case for contact follow-up.
Thank you, everyone.